Dr. Mark DuPéré, board-certified plastic surgeon practicing in Toronto. Body implant is a strong interest of mine, and buttock augmentation is probably my favorite of all body implants. Curves are back, and there's no doubt that the trend in buttock augmentation with implant is on the rise, thanks to our friends, the Brazilians. Over the last 5 to 10 years, the trend in buttock augmentation has been steadily increasing in my practice. A buttock lift and an increase in buttock fullness can be achieved via 2 techniques. One technique is the so-called Brazilian butt lift, where fat grafting is performed in order to lift and augment the buttocks. Another common procedure is a buttock implant. Now, it is very common that we will perform both techniques at the same time for a patient who desire a fuller look or an increase in fullness on the outside of the buttocks. A buttock implant is made of silicone material. It is an elastomer, soft but solid, unlike a breast implant. It is pliable and easily inserted via a small incision within the cleft between the 2 buttocks. We have several shapes and sizes available in Canada, and most of my buttock implants are ordered from the United States and from Brazil. Buttock augmentation surgery is a 2-hour procedure done under general anesthesia. The implants are inserted again via a small incision within the cleft, and both implants are inserted via this incision. The implants are inserted under the fascia of the muscle, which is the thick white membrane, very strong, that will keep the implant in position. Now, the implant is not only put under the fascia, but within the muscle itself. This will all help to camouflage and hide the edges of the implant. The largest percentage of patients requesting buttock augmentation are females. However, 25% in my practice will be done on males. So the curves are back for the ladies, but there is a trend for the Latin bubble butt type of buttocks in males. We are lucky in Canada to have several shapes and sizes of buttock implants. It is important when I assess a patient that I determine the particular shape of her or his original buttocks. There are 4 different types of buttocks described in the literature. We have the A-type, the V-type, the square type, and the round type. Now, in females, we aim for either the A-type or the round type, and for the males, we look or aim for a square type. We have here an example of a teardrop longer than wider implants that are commonly used in patients who have a longer buttocks who do not wish any outside fullness. For a patient who desires both a projection and an increase in fullness on the outside of the buttocks, we will often choose a rounder implant, which provides the patient again with that projection posteriorly, but also fullness on the outside. Again, those implants come in different sizes that will fit most buttocks. Now, when we refer to the Brazilian butt lift procedure, we are strictly referring to fat grafting, where we will liposuction some other parts of the body. We will clean and centrifuge the fat and re-inject the fat in multiple small, delicate layers within the buttock muscles and subcutaneous tissue. For my fat grafting procedure, I use the Coleman technique, which assures the highest survival rate for the fat. Now, buttock augmentation with fat grafting requires a large amount of fat, assuming that 50 to 70% of the fat only will survive. So for patients who do not have that amount of fat to give, I will commonly recommend a combination of fat grafting and buttock augmentation with implants. For those patients also who require more fullness on the outside, fat grafting is also the solution. When doing the fat grafting procedure, fat can be harvested from several areas, and usually patients will have a preference as to where they want to get a liposuction result. But the common areas chosen will be the abdomen, the love handles, the inner thighs, the upper thighs, and the lower back. A common question asked by my patient is whether or not they will feel the implants. Well, with experience, I can safely say that patients after 2 or 3 months no longer feels the implant, and this is partly related to a layer of collagen called a capsule that the body will form around the implant. Buttock augmentation is a complex procedure that is not taught in specialty training. It has its own risks and complications, and for this reason you should seek a board-certified plastic surgeon who has several years of experience in this sexy new trend.